I'll ask a question whether which patient you will do X-ray of cervical spine. So a national uh, X-ray utilization study called the NEXUS studies was conducted, which is equally accepted all over. A patient with having age more than 45 and having cervical spine pain or neurology should be radiographed. Any patient who has no cervical spine pain, has good range of motion, is not intoxicated, and has no anticipated high level of trauma itself, the patient examination itself can exclude cervical spine injury. In other cases, when the patient is intoxicated and clinical examinations is deemed inappropriate or inexclusive, in that sense, I would prefer to go for an X-ray of the cervical spine.